Okay, now the original topic, severe acute malnutrition. So what is severe acute malnutrition? There is specific class. This is a specific classification which is given by WHO to identify most life-threatening undernutrition state and undernutrition baby. Therefore, we look. This definition is given by WHO. Why? To understand this life-threatening condition, therefore we can treat this baby and we can reduce the mortality because of this. Okay, most important is 6 months to 5 years. Remember this definition at first. Okay, look here, don't forget about less than 6 months now. Okay, weight for height. If weight for height is less than -3 standard deviation or mid upper arm circumference, look here, there is what you actually do, there is mid upper arm circumference that you measure. Okay, mid upper arm circumference, if it is less than 11.5 centimeter or bilateral pitting pedal edema is present, any of this if present, we can classify it as severe acute malnutrition. Okay, and another thing, in case of less than 6 month year old, if the weight, this is same weight for, here we are using weight for height because the child is having more age, but look here, because of less than 6 months, weight for length, this is the chart we actually use. If it is less than -3 standard deviation, or look, there was mid upper arm circumference, but in case of less than 6 months you cannot measure it. Therefore visible severe wasting is very important. If there is visible severe wasting or bilateral pitting pedal edema, any three of it if present, we call it severe acute malnutrition. Okay, when a baby with SAM comes to you, by definition you can understand this is SAM, you have to assess 4 things in the baby. Okay, there is 4 things that you have to assess. One is severe edema is present or not, 3+, at least 3+ edema, or low appetite. You have to give feed to the baby. Baby is taking feed properly, that means well. Baby cannot take this feed, means baby is sick, you need to admit this baby. Okay, and another thing, medical complications or one or more danger signs according to INI-CET, if present, we have to admit this baby. Okay, so look here, this is the assessment. If any of it is present, you have to take it as complicated SAM. If none of these are present, you have to take it as uncomplicated SAM. Important thing, uncomplicated SAM can be managed at home, but complicated SAM you have to admit this baby. And here danger sign means, tachypnea, fever is present, there is poor feeding, there is lethargy, there is convulsion, all these things. Okay, suppose uncomplicated SAM, you are not admitting this patient, you have to give some advices. Okay, so number 1 is nutrition related advice. What is the advice? It should be 175 kilocalorie per kg per day. That is the nutrition needed. You have to give breastfeeding plus catch-up feeding. Catch-up feed means we are actually using F100 in India, and also this is according to WHO worldwide. Okay, and this is going to be your home feed, and eventually initially breastfeed plus catch-up feed, and then we have to shift it to the home feed, and along with it breastfeed will be continued. Okay, and what is the frequency? You have to give at least 6 to 8 times feed per day, and you have to give it lovingly with proper care. Okay, and maintaining hygiene, very important. What is the prescription note you will be doing? You have to give amoxicillin oral and for 5 days, then vitamin E and also albendazole to every patient, and whatever vaccine the child missed, you have to give it. Okay, and the monitoring should be done by ASHA worker or Anganwadi worker or ANM. Okay, suppose you have admitted a complicated case, now you are managing complicated SAM. So this is a very important question, usually comes in your exam. 10-step management of complicated SAM, you have to remember it. Okay, hypoglycemia, hypothermia management, dehydration, very important. Look, hypoglycemia, hypothermia goes hand in hand, this. There is D, there is E, dehydration, E for electrolyte imbalance, and also DEI, infection, and micronutrients, and E, you have to initiate feeding, and catch up growth, sensory stimulation, followed by prepare for follow-up. These are 10 steps, you need to read it at least 3 to 4 times, you will be able to remember all these things in your exam. Okay, very important. Look, initial 7 days we term it as stabilization phase, and after that there is rehabilitation phase, which is starting from second week to week 6. Okay, that is it. So initially hypoglycemia, hypothermia day 1 and 2, and eventually dehydration. These three things are very crucial. Within 1 to 2 days it should be corrected. And electrolytes, these like magnesium and potassium will come. Infection by antibiotics and micronutrients, no, are very important. Initial 7 days we will not be giving any iron, but iron should be supplemented after day 7, that is from the week 2, second week. Why? Look, iron is a very good culture medium. You cannot give iron to a baby who is already having infection. Okay, otherwise bacteria will grow. Okay, then there is catch up growth and sensory stimulation. Prepare for follow up. That's all. So what is hypoglycemia and how will you manage this hypoglycemia in this child? Very important. Look, by definition, hypoglycemia means less than 54 mg per dl. That is the CBG. You have to measure all this ham baby with a CBG strip. CBG strip you have to prick and you have to take blood. Okay. Suppose you don't have CBG machine or CBG machine is not working properly or battery is not there, what you will be doing? In all these cases of SAM, you have to consider it as asymptomatic hypoglycemia, and all baby should be that means all baby should receive in hospital setting 10% dextrose 50 ml by oral route, either by oral route or via NG tube or by spoon and cutlery. Okay, you have to feed. Or if it is if 10D is not available, you can use sucrose solution instead of it, and also you have to start starter feed F75, and it should be given 2 hourly day and night. So what is symptomatic hypoglycemia that can happen in this baby? Very important. SAM child presented with convulsion. You did CBG. CBG came out to be 36. So there is symptomatic hypoglycemia. You have to manage the convulsion, and also the symptomatic hypoglycemia should be managed by IV 10D. Okay. So remember 10% dextrose, the dose is 5 ml per kg. Very important. In neonate we are giving 2 ml per kg for symptomatic hypoglycemia. But here you have to give 10D, 10% dextrose, and also the dose is 5 ml per kg. Very important. And apart from this IV, you have to give oral and the same thing. Look, 10D 50 ml, 10D 50 ml, or sucrose solution via NG tube or oral route, and after that you have to start and you have to monitor the CBG. Very important. Okay. Hypothermia, very important. What is the definition of hypothermia? If the axillary temperature shows less than 95 Fahrenheit or less than 35 degrees centigrade, this is called as hypothermia. If the rectal temperature shows less than 95.5 Fahrenheit. Okay. So what is the treatment? Gradual rewarming. In hospital setting, we have a radiant warmer. We can use radiant warmer, and via this gradual rewarming will be done. And after that, you have to from starting, apart from radiant warmer, you have to use cap and cloth to the baby, and feeding should be started by F75. And remember, if there is hypothermia, hypoglycemia, these things goes hand in hand. Hypothermia, hypoglycemia, dehydration, these are hand in hand, they are going, and also infection usually underlying. Because of this, antibiotics should be given. Okay. So let's talk about the dehydration management in case of SAM. So this is very important because look, in a normal child who is not having SAM, when the child is having diarrhea, we classify it as no dehydration or some dehydration or severe dehydration. But in case of SAM, no dehydration, this classification is not available. Okay, in case of SAM, if a SAM child present with diarrhea, there has to be some dehydration at least. And you have to check the features of severe dehydration present or not. Don't worry, we will discuss in detail in our dehydration and diarrhea topic. That means that lecture, okay, in some time. But look here, in case of some dehydration, we look for sunken eye. But severe dehydration means the sunken eye, that is more sunkening. Okay, that is more sunken eye. That is it. And also you have to check the features for shock, like capillary refill time more than 3 seconds, pulse will be fast, weak, and poor pulse volume, and cold and clammy extremity. That is the usual feature in case of shock. But remember that the main message here is there is no dehydration. This classification is not available for SAM. All baby with SAM with diarrhea, you have to manage with at least some dehydration. So what is the management? Look here, in case of plan B in normal child who is not having SAM, what we are doing, 75 ml per kg over 4 hours. That is the initial treatment, that is ORS. That is the amount of ORS we are giving, and what low osmolarity ORS, and we have to monitor this child 1 hourly. But in case of SAM with some dehydration, you have to give 70 to 100 ml per kg and over 12 hours. And why there is so difference? Look here, in normal child we are correcting it by in 4 hours, but in case of SAM that is 12 hours. And why so? Because SAM child, if you give more amount of fluid in less amount of time, that is more amount of ORS in less amount of time, there is chance of heart failure. Okay, that is the reason in SAM child we have to treat it for a longer period of time, slowly. And what we will be giving? We will be giving Resomal. And how to prepare Resomal? Look, in India, most of the places Resomal may not be available, but in other countries it may be available. And what we are doing, we are preparing it from our low osmolarity ORS. One packet of low osmolarity ORS, bigger packet for 1 liter, that should be used with 45 ml of KCl syrup, pot clot syrup, with 50 gram of sugar, and with you have to mix it with 2 liter of water. That is the composition. If you do, you can prepare it at home. Resomal, and Resomal is the choice which we are using in SAM. But in case of cholera in SAM, we usually use low osmolarity ORS. Okay, so Resomal should be given in initial 2 hours every 30 minutes. And what is the dose? Usually 5 to 10 ml per kg. We usually give 5 to 10 ml per kg in each feed every 30 minutes interval in initial 2 hours. Okay, usually 5 ml per kg, we usually start with 5 ml per kg, 5 ml per kg every 30 minutes for initial 2 hours. And there is monitoring heart rate, respiratory, urine output, and SpO2 that should be monitored. And remember, when there is hour 2, that is the clock ticks 2 hour, you have to start the F75 feed. And in the 3rd hour, 1 second decimal, 4th hour F75, 5th hour 1 second decimal. That is 2 hour interval. This decimal should be continued after 2 hours, and also 2 hour interval feeding should be given. That is the reason every hour you should be giving either F75 or Resomal. That is the thing that you will continue. You have to monitor the heart rate and respiratory rate. If at any time respiratory rate increases by more than 5 per minute and heart rate by more than 15 per minute, we consider it as volume overload. We have to look for facial puffiness and edema as well. You have to stop ORS immediately, because I told you chance of volume overload. Okay, if SAM with severe dehydration with shock, what you will be doing? You have to manage it for 12 hours as well. Initial 2 hours usually you have to give IV bolus fluid, and here as there is shock or severe dehydration is present, you have to give IV. And IV fluid is given, and what is the dose? 15 ml per kg is the dose. It should be given for over 1 hour. Remember, over 1 hour. Usually what happens in normal patient, we give bolus in 10 to 15 minutes or maybe maximum 30 minutes, but here you have to give the bolus for over 1 hour because of another the same risk, that is heart failure. Okay, and before it you have to give glucose as well, 5 ml per kg, 10D, 10% dextrose, and after that one bolus, and after the bolus, and every 5 to 10 minutes you have to monitor the heart rate, respiratory rate, and pulse, and all that. If the child is responding well and good, you have to shift with your Resomal, but if the child is not responding or maybe deteriorating, then you have to assume it as septic shock. Give antibiotic, give continuous IV maintenance fluid, and also if inotrop is needed, you have to give. Okay. So what is the electrolyte management in case of SAM? Very important. You have to give potassium. You have to ensure at least 3 to 4 milliequivalent per kg per day for 2 weeks of KCl. That should be added in fluid or maybe in the feed. Okay, and magnesium, MgSO4 is very, very important. You have to give all this on day 1 itself. Okay. Magnesium sulfate, MgSO4 injection, usually IM given, very important. This is important, IM, this is given. The dose is 0.3 ml per kg, maximum 2 ml IM you have to give. Then maintenance for MgSO4 is 0.8 to 1.2 milliequivalent per kg per day. Okay. Infection, very important, you know everything. You have to give initially ampicillin, not responding, give oral amoxicillin, not responding, you have to give IV drugs like cefotaxime or ceftriaxone. And chance of sepsis, chance of meningitis is high, you have to treat accordingly. What is micronutrient management in case of SAM? On day 1, give vitamin A, very important, less than 6 month baby, 50,000 international unit. And 6 to 12 months 1 lakh, more than 12 months 2 lakh. Remember, if the child is having weight less than 8 kg, you have to give 1 lakh. For more than 8 kg and more than 1 year age, then the 2 lakh single dose on day 1 is recommended. Folic acid day 1 5 mg, from day 2 onwards 1 mg per day. Zinc 2 mg per kg per day, that should be continued for 6 weeks. These are very important. Look, folic acid, zinc, your copper is usually not given isolatedly. What we give multivitamin. Okay, this multivitamin contains vitamin A, B12, C, D, E, everything. And the recommended and what is the dose? Usually twice the dose we give normally. Okay, and all these things should be continued for 6 weeks at least. And vitamin K 2.5 mg IM stat should be given. Okay, very important, iron, we talked earlier. From day 8, that is from second week, start iron dose is 3 mg per kg per day for at least 6 weeks. Okay. So what is the feeding? Feeding should be F75. F75 means 75 kilocalorie per 100 ml of feed, and also 0.9 gram per 100 ml of feed. That is the and that is the calorie value of F75. It should be given initially as 2 hourly. Okay, and look, 130 ml per kg per day, that is what you have to give, and you have to calculate it. If the edema is present, remember, we usually give 100 ml per kg per day. And what is the calorie which is needed in this child in initial feeding? 80 to 100 kilocalorie per kg per day. First 3 to 4 days or maybe up to 5 days we usually continue F75, then we go to catch up feed, which is usually your F100 feed. Okay, remember one thing, in OPD, in IPD, for short-term calculation, for bedside calculation, we use this formula, 11 ml per kg per feed. Suppose the child is having 4 kg weight, okay, and you are giving this F75. How will you give? You can give like 44 ml, very easy to calculate. Okay, 11 ml per kg per feed, 4 kg, 44 ml per feed. Okay. So what is the catch-up feed? Catch-up feed is F100. Don't worry, right now we will be discussing and how to make F75 and F100 as well. This is maybe asked in your exam. Okay, that is 100 kilocalorie per 100 ml, or usually 2.9 gram per 100 ml, and the feed is given 3 to 4 hourly. Very important. That means more amount of feed you will be giving what you are giving in the initial feeding phase. Amount will be more, and calorie value is and look here, calorie value is also more. Here it was 80 to 100 kilocalorie per kg per day. Here this is 150 to 200 kilocalorie per kg per day, and also amount is more, 200 ml per kg per day. And after that we have to shift to the home feed, energy dense feed like dal, like khichdi, all this. Okay, this is the composition of F75. You can easily make in your IPD. Take fresh cow's milk 300 ml, sugar 100 gram, and vegetable oil which is taken 20 ml, and make the water till 1 liter. That means you are not adding 1 liter of water, you are adding 300 ml, 100 gram, 20 ml. After that you have to remaining amount should be filled with the water to make the total volume 1000 ml, that is 1 liter. Remember this. And how to make F100? Very important, cow's milk 900 ml, and also sugar 75, vegetable oil 20 ml, and water till you have to make the extra amount of water to make the total composition 1000 ml, that is 1 liter. Very easy. Okay, apart from this, we have sensory stimulation. You have to feed the baby playfully, that is at least play should be there 30 minutes per day. Give the feed playfully and also interact with the child, do messaging. All these things are form of sensory stimulation. After that, prepare for follow-up. Remember one thing, what is primary failure of treatment? Very important. Suppose the child is not gaining appetite by day 4, not not yet started losing the weight by day 4, or maybe the presence of edema till day 10. Day 10, that is the child is maybe day 12, day 13, still there is presence of edema. And if the failure to weight gain per day 5 gram per kg per day by day 10, by day 10, all these things will tell you that if any of it is present, this is called as primary failure of treatment. Okay, and what is secondary failure? Secondary failure means daily weight gain less than 5 gram per kg per day. That is called as your secondary failure of treatment. Okay, so what is the weight gain that is needed in this baby? It should be more than 10. That means good weight is, the child is gaining weight good, more than 10 gram per kg per day. If it is 5 to 10, actually we have to monitor the treatment and also the technique and what the sisters are giving. Okay, if it is less than 5, that is the secondary failure. Remember, there may be some underlying infection, maybe HIV, maybe TB. Because of this, the child is not responding. Okay, and also remember, hospital stay is usually 6 to 8 weeks, and NRC, that is nutritional rehabilitation center stay, it is usually 3 months in this baby. Okay, so, and oh, that's all. That means you actually treated this baby very well. Now can you tell what is the complete treatment criteria for SAM? That means if it is present, you can tell that you actually completed the treatment and child responded very well. Look here, according to your definition, go to the definition once again. Weight for height, if it is either equal to or more than -2 standard deviation, or mid upper arm circumference now increased, it is either equal to or more than 12.5 millimeter. That is sorry, it is not millimeter, it should be centimeter. Okay, just correct it. If it is equal to or more than 12.5 centimeter, and also no edema in last 2 weeks, we call that this child is actually got complete treatment. You completed the treatment. Okay, no edema in last 2 weeks plus either any of these two, that is weight for height equal to or more than -2 standard deviation, or mid upper arm circumference is more than equal to 12.5 centimeter. That is all. So this is a very long video. Just remember and try to remember these points. Very important topic for your exam. And if you watch this video, you can easily write the answer, 10 marks answer or maybe 20 marks answer, which usually comes in your university. As well as I think your concepts about this topic, base level concept, may be clear by watching this video. Thank you very much. Just subscribe and also share with your friends so that they can also watch this video. Okay.